We're going to explore today the impact of cannabis use on psychosis risk, relapse, and outcome. So our learning objectives today. So we really want to talk about, what is cannabis made of? How does cannabis, impact people with psychotic disorders, impact symptoms? I did want to spend some time on this kind of difficult differential diagnosis question of how do we try to pull apart cannabis-induced psychosis versus psychosis with co-occurring cannabis use, sort of primary psychosis with co-occurring cannabis use. And then at the end, we're going to wrap up with trying to identify strategies for educating clients on cannabis use, the risks of cannabis use, and try to identify ways that we can manage their use. So we're going to start at the ground floor here. What is cannabis made of? And you may think you know, and that's great. But it is a really kind of complicated drug. It has lots of different component parts to it. I'm sure most of you are familiar with THC. That's one of the main components of cannabis. It's the part that makes you feel high. It also contains cannabidiol, CBD, which is now one of the main kind of advertising points, I feel like, for a lot of products that people put forward with cannabis with purported medicinal properties. So you've probably seen CBD all over the place. But then, there are over 140 other parts of cannabis, other cannabinoids that are there in the plant that may or may not make it into the product that you smoke or eat or otherwise. But it is a really a drug with a lot of different component parts that we may not think about. And you can use cannabis in a lot of different ways, right? You can the dried flower buds, you can smoke, you can put in a vaporizer, and those tend to range in the lower concentrations of THC, right? So that can range all the way from like 4 or 6%, all the way up to 30% THC. It can be formed in resin, sort of hash cakes, and the THC concentrations there can range from quite low in certain parts of the world, actually, to very high concentrations of THC. What we're seeing more often, in the past, 5-6 years, has been an increase in the use of extracts. So oils, waxes, people dabbing, right? I'm sure you're familiar with. So these are really high concentrations of THC, ranging up to 90+% of THC concentrations in these products. And then finally, we have edibles. So you can consume THC in lollipops and gummies, and you think of it, and you can find THC inside of it. So these are just some depictions of some examples of a vaporizer, a cannabis concentrates, someone smoking. We have some gummies over here, and then of course a joint, and then a picture of the flower. So that's kind of your basic intro. This is something that I think is really interesting that you may not have seen, is that there are so many other ways that cannabis can be concentrated, right? So you can concentrate it into crumble or batter, shatter, distillate, this is what's most commonly used to make vape cartridges that people will use. You can form crystals, rosin, hash, right? So many different ways that cannabis can be consumed. And I think this, to some parents, this might be a surprise, right? You might think that you think of joints or smoking out of a bong or things like that, but there are really an endless possibility of ways to consume cannabis nowadays that it's good to know.
So I think for me, as I started learning about cannabis, which has been an ongoing journey, these words that he is saying are very important for us to know, because when you're saying, like, are you smoking bud or leaf, right, versus are you smoking batter, wax, or dab, that is like totally different concentrations of THC. So when you ask your client, like, are you using cannabis, and they say yes, you can't just be like, check, moving on. You need to understand, like, okay, well, tell me, how do you use it? What form do you use it in? Are you eating edibles? Are you smoking it? And if they're like, oh, I smoke it. Okay. Are you smoking oil through a vape pen? Are you rolling and smoking flower? Are you smoking wax? and first of all, they will be like, ooh, you've got street cred, right? Like, oh, you know the lingo. But really what's most important for us as clinicians is you're getting a sense, as Tyler was saying, like even flower can be 30% THC, but when we get to wax, like you're talking about like 3,000% concentrated THC. Folks will get way higher and stay higher for longer at that concentration than if they're smoking flower with their friends once a week. So I just want to, like, for all of you, just to really, after this is over, take a minute, come back, look at these, you know, just try to put these words into your vocabulary because they're pretty important as you're doing assessment.
And I will say that some of these are somewhat uncommon. You know, I think you're more common to run across distillates that are in the oil that people use in a vape cartridge. You know, I think others, you know, like the rosin or dry sift, these aren't something that people are using with a lot of frequency. But you know, it's good to know the you know the background behind it. You know, certainly honey or butter that people do, you know, do use those. And I think the other thing that's worth noting is that there have been interesting studies where they watch how people smoke and consume cannabis. And if you give someone who's an experienced user, you give them a joint, for example, or a pipe, you know, with flower for them to smoke, they automatically kind of titrate how they use the cannabis. So as they get more and more high, they tend to take shallower breaths and tend to you know kind of recognize, oh, I'm feeling more high, maybe I should back off a little bit. But when you come across these concentrates, it's much more difficult to do that, right? You can't you're getting such a strong concentration right away into your bloodstream that it's more difficult to back off and say, oh, I'm too high, I should maybe not take another puff, right? So that's worth noting too, when you're kind of thinking about managing use. Is there a way that they can change how they're using? If you can't eliminate use altogether, are there other ways that are less harmful, right? Okay. So contrasting the two main components of cannabis, THC and CBD. So THC is our main psychoactive component. It makes you high, it makes you feel high. A lot of people report using cannabis because they feel like it helps reduce their anxiety. They want to feel calm. They say that cannabis makes them feel calmer. And in fact, you know, some low doses of THC do seem to reduce anxiety to some degree. But there is this curve that happens, this sort of biphasic, you know, response of the drug, where as you get into higher and higher doses of THC, it actually causes your anxiety to ramp up. So people who tend to use cannabis may not recognize this, or maybe they do implicitly, but it is something worth noting that low doses might see one effect, but you might see a different effect in your mood as you increase how much you're smoking. And then one of the main reasons that we're here to talk about today is that THC does put you at risk for experiencing hallucinations and unusual thoughts, like of the delusional quality. You can give healthy people who don't have a mental health diagnosis cannabis, and they can experience hallucinations and experience paranoia and things like that. And then on the other side, we have CBD, which doesn't have any psychoactive properties, does not make you high. And there are a lot of clinical trials trying to look at where it might be beneficial. You know, there's a lot of that is still kind of to be determined at this point, but it is, you know, it is really a compound that we think might have some beneficial properties. And it has we've been looking at anxiety, social anxiety, potentially has some anti-inflammatory effects. It may have some antipsychotic properties, and it has been FDA approved as an anticonvulsant for people with really extreme epilepsy. And that is the only approval for CBD currently is as an anticonvulsant. What's less well known, I think, is that it does have some side effects. So if you take big doses of CBD, you can get somewhat tired. It can affect your sleep, and it can have you know, big effects in your GI system. So that's sort of a contrast of THC and CBD. And I added these slides in here just recently because, you know, it seems like a new day occurs and there's a new type of cannabis that emerges, right? So So you might have seen something about delta 8 or delta 9 or delta 10 THC. These were sort of more recently developed compounds, and they basically delta 8 and delta 10 THC don't really occur in cannabis that you would normally find, the normal flower. So what people do is they'll take hemp, which has almost no THC. They'll take CBD that is derived from that hemp, and they'll put it through a bunch of different chemical processes to basically convert it into these other compounds. So they'll convert it into delta 8 or delta 10 THC. And these are psychoactive in a similar way to your bog standard THC. So if someone talks about taking these compounds, you can really treat it in a lot of ways, like they're consuming your typical THC in cannabis. It is a little bit unique in that since these compounds are typically made from hemp, which is legal federally, that there was this sort of loophole where people they can be sold and consumed somewhat legally, but it's really this gray area. And in fact, California has changed its laws to now restrict all of the different kinds of THC that you could find. And these are other, on the other side of the equation, these are some parts of cannabis that again usually have to go through some sort of lab process, most of them. Converting CBD into something else. They usually don't occur in very high concentrations at all in your natural plant. But these are not intoxicating. They don't make you high. But you will find all sorts of advertising material for people who sell these products who say, you have indigestion, well, you should take this, or you have, you don't sleep well, well, you should take some CBG. And so I think there is some dubious advertising about these compounds, but at least from what we know so far, these don't seem to have a whole lot of risk for psychosis per se. They don't necessarily make you high, but just so you're aware, of what these compounds are. And then finally, I'm not going to dwell on this a whole lot, but and it's separate really from cannabis. Per se, but K2 or spice, these are sort of synthetic cannabinoids. They mimic THC to some degree, but they're much more dangerous. So people have really extreme psychosis and even have died from taking spice before. So it's quite a dangerous compound. So let's just talk a little bit about how cannabis has changed. So it used to be that cannabis that you would purchase or get from the guy down the street, in the 70s and 80s had a fairly low amount of THC. So in the range of, 3 to 4%. But as you can see, starting around the year 2000, the THC concentrations in the cannabis we use skyrocketed. And now you can regularly find, I should change this, it's now regularly above 30% actually of what you can find most products and dispensaries, the amount of THC. And kind of what we've seen as well is that the amount of CBD has really dropped in cannabis. So you're sort of increasing the THC concentration at the same time that breeders who've been making these plants have sort of bred out the CBD as well. So you're getting more THC to CBD in the product that you're buying. So before, it used to be about 10 to 1 of THC to CBD. Now, it's more like 120 to 1. Hardly any measurable CBD in the products that people would buy, from a dispensary or get from someone else. So that means kind of this other side of cannabis. So CBD, we think, might have some antipsychotic properties that might, kind of work against some of what THC produces. You actually get very little of it now in the type of cannabis that you smoke. So just to kind of a take-home message about this, it's worth knowing what these two compounds do. They're very different, and kind of just understanding their general concentrations in the product that you would find, and the fact that the cannabis that we smoke today really is different from what has been around, historically, and it is much more powerful. And the thought is that these higher concentrations of THC that we have in current cannabis potentially has a much greater impact on our brain and ultimately our behavior. So let's talk a little bit about that. we should know that cannabis does affect our biology, and the use of cannabis affects it. So it's not, I've talked to a lot of different families, and it's not always really well recognized that smoking cannabis during pregnancy can be dangerous. I think some people don't realize that, right? But in fact, some of this compound, these compounds do reach your developing baby. And most of this research has been done in animal models, where they might expose a mouse, to a pregnant mouse to cannabis. But they do find that the infants that are born to these mothers that have been exposed to cannabis do have some unusual behaviors. Their emotion regulation is disrupted, cognition and ability to think is disrupted, and you see effects on the brain as well. Due to smoking during pregnancy. You can also expose your baby to cannabinoids via breast milk. So if you're smoking cannabis and you're trying to, maybe you're self-medicating for dealing with the, lack of sleep and a crying baby. I know I experienced a lot of stress when our children were born. But your baby would be exposed to those cannabinoids via your breast milk, and we have seen research where it does impact brain circuits of babies who are exposed after birth. And these are typically brain circuits that are involved in things like motivation, inhibition, things like that. And it's affecting these parts of the brain that we actually see that are impacted in psychosis. So there's this sort of overlap, in the areas that we see that are disrupted in psychotic disorders and areas that cannabis seems to impact. And that's part of why we think that cannabis puts people at risk, for psychosis. And then finally, this is probably the most relevant for a lot of our clients, is this adolescent exposure. So during adolescence, you can kind of think about it as this is the time where our brain our brains have actually kind of over-connected. We've made more connections than we need in our brains as we're developing children. And then in adolescence, your brain is going through this process where it says, okay, I don't need these connections anymore. Let me get rid of them. Let me just focus in and get a finely tuned brain that just has connections that I need. And so one of the thoughts here is that the impact that cannabis is having, if you're using it during adolescence, it may actually cause over trimming of these. So you're sort of connecting, you're clipping off too many connections, which can be detrimental. And then ultimately, the biggest risk of using cannabis during adolescence is the risk of psychosis, an increased risk of developing a psychotic disorder. So I will dive into that next. So people who have a psychotic disorder, cannabis really is the preferred illegal drug. Alcohol is, of course, up there as a preferred drug of choice, but in terms of federally illicit substances, cannabis is at the top. And anywhere between 20 and 70% of our clients with schizophrenia have some cannabis use, with about half reporting recreational use, and about a quarter eventually developing a cannabis use disorder. So it's very common, and I think that's why it's always at the top of people's lists of wanting to learn more about. But what we have learned, over, the past 20 plus years is that, and this has been repeated across a number of different studies. I've just sort of made this graphic kind of distilling a lot of the information that we know, but use of cannabis does significantly increase your risk of developing a psychotic disorder. So this was a study that was conducted in the UK, where they basically tracked people, their what types of cannabis they used and how strong the cannabis was that they were using. And what they found is that people that tended to use stronger cannabis were much more likely to show up at the hospital with a psychotic disorder. And in fact, if you were a daily user of strong cannabis, you had over 5 times greater risk of ending up in the hospital with a psychosis compared to those who never use cannabis. So I think this is a really, kind of key graphic to consider, when relating this information to families whose children might still be considering using cannabis.
So I'm going to channel a family.
Okay.
That's like, Well, our cannabis isn't a problem. I'm seriously thinking about a dad I talked to, right? It's not that bad. I smoke too.
Mm,
And just really a diminishing of the risk. And for me, when I look at this slide, I think one of the most important pieces is it's like, because I think sometimes people get caught on the daily use. Well, I use it every day and I'm not psychotic.
uh-huh.
I mean, I don't want anybody to think I actually do that. But, this dad was like, I
You're
use every
channeling.
day. I'm not psychotic. And but I think one of the things that a lot of our parents don't think about is the strength of the cannabis now. And so it really is helping like parents understand this is not your 70s weed anymore. And so then I think what I'm starting to hear in some like small communities, out when we go out of, the valley up into the foothills. Well, I know Bob and Bob grows this weed and it's great. And it's not bad weed, right? Like
Mm,
now there's like this like idea of like that, well, there's the problem weed and then there's the not problem weed. Bob doesn't grow the problem weed.
hmm
Would you say that the majority of weed that is grown now is still genetically modified to be, as you have labeled here, strong cannabis?
Well, absolutely. I mean, you'll have a harder time finding weed cannabis. I mean, I think that's the thing, right? If you were to go to your average dispensary nowadays, you would have to, really specifically seek out those other strains of cannabis that usually are marketed more for sleep aids, or I have arthritis and I have chronic pain, or I think sometimes they'll do lower THC varieties with higher CBD, and I think that's the marketing ploy, for the lower strength cannabis. But I think most often if you were to go and grab something off the shelf, it's going to be a high potency THC variety. But I think to add to your point, right, I think what we would say to that dad is that, sure, you came through this okay, right? You're able to smoke cannabis, you don't experience psychosis. And in fact, a lot of people can smoke cannabis and they don't become psychotic, right? That is absolutely true. However, there are a subset of people who, partly through genetics, partly through early life experiences in utero, or post-birth, like experiences or exposures to stressors or malnutrition, any number of factors, right? You have all of these things that are coming into the equation for some people. And for some people, when they are exposed to cannabis, um, they do become psychotic, or they can have significant symptoms that emerge from it. And I think what we have to stress to people is that do you really want to risk you being that person, right? If you have a family history of psychosis, is this really, in terms of a risk benefit ratio, are you getting so much out of cannabis that it's worth it to you to risk these really adverse symptoms? And what I'll get to later is that these symptoms can actually cascade into a lifetime psychotic disorder, right? Which we don't want. So yeah, I think it's a combination of the strength, but also these other factors that you're entering this world with, and that you enter adolescence having been exposed to, right? That put you at greater risk as well. And so there have been a lot of studies as well that have looked at how cannabis use might impact your outcomes depending upon when you use it. So I mentioned that kind of critical adolescent period where there's this period where our brains are going through a lot of different changes and pruning away connections. And what has been found is that the earlier you use cannabis, the worse your risk for developing psychosis. This is just trying to illustrate, someone who uses cannabis before age 15, has almost a 5 times higher risk of developing psychosis, whereas that risk goes down a bit if you're using cannabis before age 18. And then, if you've never used, your risk is at a 1. But the earlier you start using cannabis, the higher your risk, and generally the more dangerous it has, for a negative outcome. And I think this is something that we can highlight to people as well. So even if your cannabis use isn't associated with or kick off a psychotic disorder per se, we do know that using cannabis increases your likelihood of having what we call psychotic-like experiences. So these are, attenuated symptoms of psychosis, not a full threshold psychotic episode, but having unusual experiences, like hearing things that you wouldn't normally want to hear. And to some degree, adolescents have some of these experiences, right? It is somewhat normative to have some psychosis-like experiences. But what we would expect as you work your way through adolescence, here, ages 14, 15, 16, we would expect these PLEs, these psychotic-like experiences to go down. We expect them to go down as you get older, right? But when they, in this study, they tracked, hundreds of adolescents and their cannabis use, and those who use cannabis weekly actually saw them, increase, and quite a bit. And those increases lasted even for years after they stopped smoking. So this is just to illustrate that even if you have someone who says, well, like, I don't get psychotic when I smoke cannabis, well, at least the data suggests that maybe you didn't become fully psychotic, but you're more likely to continue to experience some unusual things like hallucinations, paranoid, maybe subthreshold paranoid symptoms that are increasing in comparison to your peers, who aren't using cannabis. So just to shift gears, just briefly, I'll touch on this. I know some families will ask, well, CBD, it seems to be really good. Can I give CBD to my child? Will it help, with different things? So they have looked at CBD and to see if it was effective to treat psychosis. And there have been 3 studies as of the last time that I was able to look. An early study compared CBD to an antipsychotic. Other studies have sort of added CBD on to normal treatment. And I will say it's pretty mixed. So these are, one study showed that CBD was somewhat effective. Another one actually showed that there wasn't a benefit, and actually it made people a little bit more sedated. So the jury is very much still out on whether CBD is at all effective for, helping with our psychotic symptoms. And the challenge here is that, these are hard studies to do. And, historically, very few people are actually are in this are in these studies, about 20 people in each group, which really isn't enough to give us a whole lot of confidence. And I think the challenge is, I've talked about CBD maybe being an anti-inflammatory and helping with, intractable epilepsy, and maybe it could be, a potential antipsychotic, right? So you might ask yourself, well, and given the marketing, why don't we hand out CBD to everybody? And the challenge here is that these are very small studies, they're lab controlled, and the challenge with CBD at this stage, there's such a small amount of research that we really don't know, like what amount of CBD would help treat something, right? So if you go to a dispensary, you're most commonly going to find CBDs that are something like in the corner, or sorry, CBD gummies that I have here in the corner. So here we have a bottle where each little gummy is 25 milligrams, right? If you were to look at studies where they treated people with epilepsy with CBD, it's around 600, 800 milligrams, right? So you'd have to have a couple of bottles of these each day, right, to meet that level of CBD. So and then you start getting lots of side effects, right, like diarrhea and fatigue. So there's really no idea of what a dose would be to try to treat some of the symptoms, or to try to treat that might have anti-inflammatory effects. And to add to that, the CBD that you can buy at most places really isn't very well regulated, right? It might not have the CBD that it states on the bottle. It might even have some THC in there, which you don't want usually. And I think that there was a recent article that came out, I think it was actually in the news that I saw the other day, where the state is having to deal with some issues with testing facilities not being fully transparent about the way that they test samples that go into dispensaries. And so, in fact, the THC concentrations that you see on the labels that give you to the the decimal point, how much THC you might find in what you're going to smoke or consume, are maybe not completely accurate, and that there's a push by a lot of labs and manufacturers to try to get the highest THC possible, in what they sell, because it sells for more. People are more interested in buying it. So there's this kind of labeling testing issue in what we're buying that really makes this area pretty murky. And again, just to sorry, my picture is being cut off there, but just to kind of drive this point home, the only thing that the FDA has approved CBD for is intractable epilepsy in childhood, and it does seem to work quite well, which is really exciting. So I think families are asking about CBD, you can point them back at this information, right, and say this is the only thing it's really been approved for, and we don't know a whole lot about why it might, how it might work for other types of symptoms. And I did want to briefly talk about other symptoms. So we focused on psychosis a lot, hallucinations and delusions, and that is what generally receives most of our attention and tends to be the most treatable, right? With antipsychotics, we can treat our psychotic symptoms, but really cognitive symptoms are one of the strongest predictors of someone's functioning day to day. And so, we would really hope to be able to target cognitive symptoms to some degree, and helping our patients live their best lives. So how does cannabis affect cognition then? And I'll just briefly touch on this. If you put someone in the lab and you have them smoke cannabis, or you give them THC intravenously, maybe you won't be surprised that it doesn't help them think better. It does impact their cognition generally negatively. People's learning, their memory, your inhibition, your attention, your processing speed, how quickly you're able to kind of think through things, all of that declines when you're high, basically, which you're probably not surprised by. There's some indications that people with psychotic disorders might be extra sensitive to this effect, but that's not, we still need some more research on that. And then long term, so what about if someone's smoking cannabis for years and years? How does that affect your thinking, your cognition? And what has been found in longitudinal studies and other studies that have sort of looked back at people's historical levels of use, they found that people who tend to use cannabis regularly, score lower by about 8 IQ points, basically, compared to people who don't use cannabis. Which, I think no one particularly wants to lose 8 IQ points, right? Some of us don't have much to lose, and I think it's important we keep this in mind. And I guess the silver lining here is that a lot of studies have shown that if you stop using, some of that will come back. So there's this idea that if you discontinue use, you can recover, some of your cognition back closer to what you started with. So that's, I think, is really encouraging. And in individuals with psychosis, we see something similar, that you do have this negative impact related to continuous use of cannabis. And if you look at impact on the person's symptoms, you do see that the more people tend to use cannabis, the more often they're in the hospital, the longer time they spend in the hospital, and shorter time until they relapse. And part of the thinking here, I'm going to get to it in a second, I think, maybe not yet. I'll come back to that. But part of what we think might be related to that is that there's some indications that cannabis use makes you a little less likely to adhere to your normal medication regime. So you're more likely to skip a dose or forget potentially to take some of your medication. And then that might actually make you more likely to have symptoms get worse. I won't dwell on this slide, but it's basically just illustrating a few really big meta-analyses that we've had come out lately in the literature that suggests at this stage there really is not sufficient evidence to suggest that any of these cannabinoids really help treat mental disorders in any significant way. That's not to say that that might change, right? I think that there are the last time I checked, there were 150 plus clinical trials on CBD, right, looking at its effects. So we will absolutely learn more. They're looking at it with PTSD and anxiety, other anxiety disorders, and So there's a lot more that we're going to learn. But at this stage, I think the evidence is still scarce. And the challenge here is, of course, we're dealing with this really long timeline, right? It takes a long time to do research, to test compounds like cannabis or CBD in animals, 5 to 7 years to run clinical trials. So you might be looking at 10 years, right, before something actually gets through FDA approval, as being approved as a medication. So it's difficult to ask, families to wait, but we're kind of in that waiting game right now with these compounds. So transitioning then to kind of our second point for the set of slides is really to look at how do we differentiate between these two kind of presentations. And I know in our clinic, this has been a subject of a lot of debate, some lively case conferencing discussions, right? How do you differentiate between someone who comes in and is this psychosis that's driven purely by cannabis? Or is this someone who has a primary psychotic disorder and cannabis just made their symptoms worse, or made them maybe was the environmental kind of component that really kicked things off for that person, right? And I'm not, you can refer to this table later. I did want to just illustrate how you would differentiate between someone who's intoxicated on cannabis, where you might get some subthreshold psychotic symptoms, but really nothing severe. And you wouldn't expect someone to be clinically distressed or impaired if someone is just high, right? And that's different from someone who's actually experiencing threshold significant psychotic disorder or psychosis symptoms, that are emerging really proximal to cannabis use, really soon after they start using cannabis. So our main factors to consider here are, so I'll move forward, but you can refer to this slide, but the timeline is ultimately going to be really critical here, right? Did we see psychotic symptoms occur before the person started using cannabis? If so, that puts us more on the path of considering a primary psychosis. And I think the persisting is the other main component. So once we have psychotic symptoms, how long do they last once the person backs off of their cannabis use? If the symptoms go away really quickly, right, that kind of makes us think this is more of a cannabis-induced psychosis. You get into weeks. Are the symptoms lasting weeks after they stopped using cannabis? And I think traditionally we might think, well, that puts us in the direction of probably, if they're still having symptoms weeks after they stop using, we're thinking probably it's more primary psychosis. But I will say that this has become more murky lately with these really high potency variants of cannabis that people are using. If you're using wax multiple times a day, you have a lot of this compound in your system. It's taking a while to clear out. THC and cannabinoids are stored in your fatty tissue, and so it actually takes a lot of time to clear that out of your system. But certainly if someone's still showing psychotic symptoms months or greater than a month or months after they've stopped using cannabis, I think we're really, in this case, thinking it's more likely to be a primary psychosis. I should mention that the actual first experience of a psychotic episode for someone, or the presentation, say at the hospital or your clinic, could be identical, right? Someone who smoked cannabis and has their first psychotic episode that's kind of kicked off by cannabis might look identical to the person who's never used cannabis before, right? And so I think you really have to pay attention more to the timeline of that person's use pattern to really figure it out. And ultimately, you'll have to see them over a long period of time, 6 months or more, to really unpack this and try to understand, what the driver of their symptoms is. But no matter what, for that person, since their psychotic symptoms emerged in the context of cannabis use, that means for that person, their biology, their history, all these other factors for them, like Tara was mentioning that dad and that case as an example, we know that for them, cannabis is going to continue to be a significant risk factor for them in the future, and is more likely to kick off future psychotic episodes. And in fact, this has been looked at over time in a few different Scandinavian samples, where they actually found that they looked at a sample, everyone who'd been diagnosed with a cannabis-induced psychotic disorder. They then followed them over 20 plus years. And what they found were that over half of those people who were initially diagnosed with cannabis-induced psychosis actually were given a schizophrenia or a bipolar with psychosis diagnosis years later. So you could say, well, maybe they were misdiagnosed initially. That's a possibility, but it also potentially indicates that these cases may transition into a primary psychotic disorder, particularly if the person continues to use, right? So it's kind of something good to kind of have in the back of your mind when you're seeing these cases, that sure, it might look like a cannabis-induced psychosis now, but we really need to track that person over time. There is a decent chance that the presentation may persist and continue to look more like, or may look more like, a primary psychotic disorder that's exacerbated by cannabis. And in this case, we see half, and this is actually half the cases we're transitioning into primary psychosis or mood with psychosis, actually within the first 5 years, the first 3 to 5 years. You didn't need to wait 20 years for this to happen. It was happening relatively rapidly. The short answer to this is that I talked about THC concentrations going up. We do see evidence that cannabis-induced psychosis rates are going up significantly. There's also evidence that psychosis caused by cannabis use rates have been going up and quadrupling. So there's a lot of evidence that, or new evidence that cannabis is making things a bit more complicated for us who work in this field. So yeah, I'll let Tara take over here.
I think for us, the way we really conceptualize cannabis use is as a coping skill, right? It's kind of sometimes fun, which in adolescence makes sense, but it's also a coping skill, like alcohol. And sometimes when those coping skills get out of bounds or are not being used effectively, that's when we start to see problems. So really thinking about our treatment and how we approach, and I know I'm talking about this in the context of cannabis use, but I think you can actually broaden it to substance use as well. And for those of you who know DBT, this might sound familiar to you because it is seated in dialectical behavior therapy. We try to regulate our feelings. And when we do that, either we have effective coping mechanisms to do it, or we have ineffective coping mechanisms, right? And a lot of our folks they might be young and still developing, and that part of their brain isn't online yet. They might have experienced trauma. They might be in highly stressful home situations. There's a lot of reasons why they're having trouble regulating. And so they can turn to substances, including cannabis, as one way of coping with distressing symptoms or general emotion dysregulation. And I think one of the things that Tyler's pointed out that can be difficult as an adolescent or young adult to keep in mind is that we've heard today how cannabis can have other negative consequences. It can make your positive symptoms worse, your anxiety worse, you can have cognitive impairment, but we also know it can have legal and physical health consequences. And we know that adolescents and young adults aren't great at keeping those things in mind. So really what we're going to be focusing on in treatment is sort of understanding the function that cannabis plays. Is it social grease? Is it a coping skill? Is it what the family does together? Like there's lots of different functions it can play, helping the person understand that there are other skills or other activities that could replace this less helpful skill. So thinking about replacement skills to help you manage symptoms, distress, be social, whatever it has. And so I think for us, what we really try to think of is understanding the function that a substance is playing, and then coming up with alternatives that avoid negative consequences and promote the positive things that we're looking for. So one thing that, in this work, I've really helped or tried to purport, and I've gotten good responses from folks as I've encouraged them to use this. We were talking about Bob and his friend Tom, who grows weed up in the hills, right? Or in his backyard or whatever, and Bob's like, but I can smoke the weed and I can get high and I'm fine. And I like to use an analogy, right? well, that's fine. It's fine for you. Just like peanuts are fine for me. But if I said to you, Bob, I have a peanut allergy, you wouldn't make me eat a bunch of peanut butter because you understand that that could be really bad for me. For your son, daughter, whatever, right? Let's think of it as like they have a cannabis allergy. And for them, they have negative consequences. So how can we help this young person that you love come up with other ways to relax, enjoy themselves that aren't going to trigger these negative consequences? And I think in a social situation with other peers, when you're passing the whatever around, hey man, I'm allergic to that. So thanks, but no thanks, is something that your peers can understand. They might not be able to understand all of this elaborate information that Tyler has just shared with us, but they can understand what an allergy means. So that's one of the ways that we've been able to have some of our youth be able to manage these different situations. So you guys should be familiar with the vulnerability stress model. We talk about it a lot, right? And we do not understand the biological vulnerability that is playing a role here. There is something and we are looking for it, but we're not sure. But what we do know is for this subset of individuals, cannabis is a stressor on the biological system. And so this idea of saying like putting cannabis into this person's system is a stressor that increases their risk of going from no symptoms to symptoms. And so these are really important pieces. And I do want to note that one thing we do know is having a family history of psychosis and then throwing cannabis use on top of it, there's something there that increases that young person's risk for then having psychotic symptoms in the presence of cannabis. So in particular, when we have folks come in and we hear about a family history, even if they're not using cannabis, we'll say to them, cannabis might not be a wise choice for you. This is what we know. So let's stay away from it. So again, I really want to frame this in terms of a DBT or CBT harm reduction approach. Like really just trying to think about how you're going to increase skills for distress tolerance, social skills, what have you. How can we reduce harms? How can they ask for CBD heavy strains? How can they switch strains? How can they switch from wax to flower or from oil to flower, where they, as Tyler was saying, they can control that sense of high. It comes on a little differently so that they can titrate a little bit better. Stepping back from some of these things in a substance use sort of way, but making sure we're not taking an abstinence approach at the get-go, because it's hard, right? If you're going to take away somebody's skills for coping, you better give them something else or they're going to relapse. So really thinking about it that way. So if you can get them into substance use management, go for it. I think the challenge in the US is this isn't considered a substance anymore. This is like a beer. Like you have a joint, you have a beer, you have a shot, whatever. It's very much that way. So I do think that's why framing it in terms of a coping skill or social grease or those other things makes it much more palatable for folks to think about changing behaviors. Motivational interviewing can be so helpful in understanding reasons for change. One of our interventions is a substance use management group, and we've really infused that with DBT skills. And so that's something we will be disseminating within the TTA. Okay, so here's examples. High THC, switch to low THC. Really thinking about legal consequences, making sure that people are reducing health risks, and then finding partners to help support them and making these lifestyle changes. Hopefully this has been helpful to everybody. And we look forward to getting your questions.
Yeah, thank you all.